Welcome. First, I'd like to acknowledge that this meeting is being held on the Coast Salish traditional territory. And this is the first inaugural meeting of the Director Services Select Committee, and I call it to order. First order of business, Mr. Barry?
Madam Chair, would be the approval of the agenda.
Do we have a motion? Moved? Second? In favor? It passes. Adoption of the minutes we do not have, since it's an inaugural meeting. Business arising from the minutes does not apply, and public input period. Do we have anyone from the public that would like to speak? Welcome.
Thank you, Madam Chair. Good afternoon.
Nice to see you.
You too. Former director, I think it's about time that you stop pretending that this is a part-time job and compensated accordingly. Like even the counselors in North Cowichan, they get paid what, 28,000 now, plus the 17, 18 here, so close to $50,000. And I would argue that an area director certainly makes, or certainly works at least that much. So yeah, it's a very challenging job, as we all know, so best of luck.
Thank you. And I don't see anyone else from the public at our first inaugural meeting. Next we have any delegations, Mr. Barry?
No delegations, no correspondence, but we do have two staff reports. And the first staff report from the Human Resources Manager regarding the scope of this select committee.
Mrs. Mohan.
Thank you, and through the chair, I just wanted to take an opportunity to review the motions that resulted in the establishment of this committee, and also how they defined the scope of the work of the committee. So just for a quick review, that this was a motion from the board meeting of Wednesday, November 28th, saying that a Director Services Select Committee be referred to the regular board meeting on December 12th, and so on December 12th, it was moved and seconded that a committee be established to consider directors' compensation and expenses, benefits, training and development, and a code of conduct. So in terms of the scope of the work of the committee, that's how it has been defined through the motion at the board. That motion also defined the membership, so directors Acton, Yanni DiNardo, Marsh, McGonigal, Morrison, Nicholson, and Stone. And that Director Acton be appointed the chair, and that Director McGonigal be appointed the vice chair, and that as a select committee, it is a term committee, meaning the work of the committee is to be conducted over a number of months and report back to the board in June of 2019.
Thank you, Mrs. Mohan. So the will of the committee to discuss some of the criteria? Director Nicholson.
I think I had a mental gap. Could you just repeat what the main jobs we have?
Sure. The terms of reference are to make recommendations to the board with respect to matters associated with directors' compensation and expenses, benefits, training and development, and a code of conduct.
Director Morrison.
Thank you, Madam Chair. So this came up in discussions with directors prior to the selection of the board chair and vice chair, and this is it goes back further than that, in that the previous board received reports from Ms. Mohan on the compensation. There were some comparators made available, and we were also discussing the CRA impact of the decision on the 1/3 tax-free. So it was, maybe it's unfair to say, punted to this board to discuss anything beyond the adjustment that was made for the CRA and the annual amount linked to the collective agreements. So I think there was a desire to look at compensation. That's important. I hope we can tackle that. When it comes to the code of conduct, I think there's been a lot of work done in the province from various groups and even North Cowichan, and I'm hoping that this doesn't take up a lot of the work of the committee, because I think there's good examples, and don't want to say we will cut and paste, but we might end up doing just that. But we should make something that's appropriate for this organization, I think. So I think we should be looking at compensation. I think the code of conduct's important. And we may have to have a broader discussion about the needs of the newer directors on the board around training and what some of the things that they would deem to be important. That was something that I thought was sort of important when we were doing the corporate strategic plan, the idea of training and skill development. I might look to Mr. Carruthers as to refresh our memories as to how important and how much air we gave that issue early on in the previous term, and I think that will obviously come up again when we do our corporate strategic planning. So I'm looking forward to the work of this committee. I think we got a couple of tough things to deal with, so thanks.
Thank you. Director Stone?
Yes, to echo some of Director Morrison's comments, I think the around the code of conduct, I think there are great samples. I think it was North Cowichan looking through their code of conduct that kind of sparked that this is a great foundation, but also being able to look at other local governments that are exhibiting best practices around the code of conduct piece. Including UBCMA, VICC code of conduct pieces. I think we could bring those in as well as, you know, so we could develop a draft here that we could submit to the board. And I would argue that if we can work through at this committee a draft, that it shouldn't wait until June of 2019, that piece could be forwarded to the board sooner. So I think that in terms of length of time, at the next convening of this committee, it would be nice to have from staff some of those samples, maybe from the local government associations around code of conduct. The province had, when we were newly elected, along with their congratulations letter, was their code of conduct for local governments, so that's an important piece. And then most relevant here would be North Cowichan's code of conduct, and I did note that when they took their oath of office that they also included in that some adherence to that code of conduct. So I think that those pieces were all stuck out to me as valuable in the discussion. So I think we could probably, you know, dive into that piece at the next meeting of this committee, and hopefully over a couple of meetings be able to pull together a draft that we could forward to the board for adoption, or at least consideration of adoption, with the guidance of staff, of course. As far as the training and development, I think you alluded to it at the end. My experience in the previous term of the board is we started out very strong, and some of these were maybe not practical training and development, but more about understanding our relationships with the First Nations, and those events and activities seem to provide two benefits, and one was obviously the actual training and understanding we were gaining through those events and those training opportunities, but also team building within the board, and I think that's really important. It doesn't mean that everybody's you know, sort of developing strong personal relationships, but just understanding each other better, so that when we come to the board, we have a better understanding of people's perspectives during deliberations on all kinds of issues. And then finally, around the compensation, and of course that would include a discussion around benefits, which I think is included in the next agenda item. A review of that is important, but not only, you know, I think the broader discussion around the commitment that was brought up by our public input is important, because, you know, I just had this conversation in our municipality with a community member, and, you know, I gave them my schedule and gave them the opportunity to thumb through a couple of months of my schedule, and they were actually pretty taken aback about the commitment level, that often, I would say at least 2 to 3 days every week, it's 9 a.m. to 9 p.m., and that doesn't include all of the unaccounted for time in the evenings, reviewing agendas and budgets and all of those things. And I think that the level of workload in my short experience, only 4 years, one previous term, the increase even during that time. And the reflection that I had was from people who had been around for 2 or 3 terms previous was, at the beginning of the last term, oh, it's way more than it ever was even 5 years ago. And it seems that in the last term, I would say that that commitment level has even increased at a more rapid pace. As some of those more challenging issues that we're trying to grapple with get sort of, I don't like using the term downloaded onto local government, but seen as a responsibility of local government by the citizens, climate change adaptation, some of the issues around housing and homelessness. There's an expectation in the communities that there is going to be, those issues will be addressed at the local government level in some fashion. And as those expectations increase, so does the workload that goes along with it. So obviously, I feel like that's an important discussion to have. But I think that priority would be, from my perspective, that code of conduct, and then making sure that we establish a consistent level of training and development that would maybe not be as heavy as the last couple of months, but have something regular throughout the year that would help us grow our capacity, but also to further deepen the relationships that we have as board members as well. So I wholeheartedly support those, and I think the compensation discussion is probably a longer, more protracted and involved discussion. But so that's my input on those.
Thank you. Director Yanni DiNardo.
Thank you, Madam Chair. Mine would be as well, priority for me is definitely the code of conduct. I've spoken to the chair about this a few times. And also, I believe the benefit package that we had too, I thought that I had spoken to about that as well, that it would need to be upgraded. So my number one priority is the code of conduct. So I'm looking forward to working on that.
Could I suggest maybe to Mrs. Mohan, do you have enough information to come back with some suggestions around the code of conduct for next meeting?
Through the chair, I don't have that information at my disposal right now, but
No, enough
depending,
direction?
yeah, I would happily bring some examples to the next meeting as long as there was enough time for me to collect them, but yes.
Thank you. And we've had quite a few comments on benefits, training. I know that benefits is key and timely for today. Are there any other comments that we would like to make or direction on the other items, or we can ask to bring them back for further discussion? Next meeting. Director Marsh.
Yes, thank you. I agree pretty well with what the order, the code of conduct being pretty critical, but also training and development and relationship building. And I think that it would be good if we could do a similar thing as some of us did in Cowichan Bay. It was unfortunate that a third of the board wasn't able to come, and could be flu season or whatever was going on. But I think that we're kind of under the microscope a lot in this endeavor we've stepped forward for, and it sometimes we're on the opposite ends of a debate, and we're human beings and we have our little quirks, and sometimes people can be offended. So I think the best way to try to get around that is to do these kinds of professional trainings occasionally that help us see each other as human beings with largely probably very similar values, but maybe just different philosophies about how we realize them. And I think the work that we've done around that at North Cowichan or any other endeavor I've been involved with, I think it's kind of, it's hard to really quantify, but I notice a difference when the work doesn't happen. It doesn't mean that everything's always perfect, but I think when you don't address it at all, boy, we had a term like that where there was not everyone wanted to participate, and there was a lot of angst in this term. And I would like to see us just kind of use, the social sciences to learn about how do people work together who have different, similar things and different things, and how do we come out after those tussles of debate and still be respectful and not take it personally. I can learn that too. I'm not pointing any fingers anywhere else, but.
Thank you, Director Marsh. I too have done some of that training with previous positions where your colleagues run through the program, and understanding how people receive feedback or how they might approach a situation is very useful. Perhaps could we turn to Mr. Carruthers? Could you review with us some of the training and development that's on the horizon for us?
Oh, not used to this side of the room. Thank you, Madam Chair. We still have a fair bit to cover in terms of orientation. It's been preempted by the budget process, but we will resume in February in terms of some organizational orientation around the organization itself. You've got a seminar coming up on the 30th of January from George Cuff talking about some pretty in-depth discussion around roles, responsibilities, that kind of thing. What I'd be looking to the board as a whole, or potentially this committee, for some recommendations around topic areas. I think ongoing development is critical for the board, and we experienced that last year. We actually developed a list of all of the training opportunities that we had provided to the elected officials over the course of the last term, and it was actually quite significant on a variety of topics. But I would really like to see that be somewhat directed by the committee as opposed to staff coming up with the ideas. So, once we finish up the orientation in and around end of February, I'd be looking from this group some ideas around scheduling and finding the resources that we could bring in if we needed to bring outside resources in to do some more developmental, and not just about the workings of the regional district, but really some developmental around leadership, around decision-making, those concepts that you're dealing with on a regular basis.
So we're going to dive deeper into training and development on a later date. Thank you. And we have explored the code of conduct. Is everyone happy with the amount of input they've given? And is that enough direction for staff to come back next time? We agreed on that already. Oh, Director Marsh.
I just wanted to add that is there a code of conduct for staff here?
Through the chair, yes, there are a number of different policy documents that govern the behavior of employees and volunteers and that kind of thing. It's not one single code of conduct, but there are a number of different policies, yes.
Yeah, so we, at North Cowichan, we kind of meshed those so that the standard was equal. Because I think one of the challenges is councillors and directors are not staff. And sometimes the behavior of those individuals that aren't staff, how does staff discipline that, right? So I'm glad that you're going to look at what North Cowichan came up with, because it really syncs with what happens for the staff as well.
If I may, through the chair.
Oh, Mrs. Moham.
So when I speak to a number of policy documents, there's a couple of policy documents that are really internal facing for staff around code of conduct, but one of the overarching policies that we have is our respectful workplace policy, which is one that actually applies to all CVRD. So it does include the elected officials in that policy, and it's a policy that's mandated for every organization to have through WorkSafe BC. So certainly the board is covered under that policy. The other policies may be more specific to staff, but respectful workplace and code of conduct are not synonymous, and so I do think that there are lots of good examples out there in local government of a code of conduct for elected officials that we can definitely look at that will be consistent with our respectful workplace policy.
Thank you. Director Stone.
And further to that, I think that roles and responsibilities piece needs to be folded in with the respectful workplace to develop a code of conduct for the board. Understanding the roles of a policy board, of a group of elected officials versus the operational responsibilities of staff and where those lines are as part of that code of conduct. So not only in how you treat each other, your staff, but where those lines are and the appropriate sort of courses of action if there's an issue from an elected official standpoint, through the chair and the CAO, and how we engage with our staff as well. I think that's an important piece, and they need to sort of coexist, is that roles and responsibilities piece, which we'll have some training on at the end of this month, then aligned with that respectful conduct piece. So when we look to develop a code of conduct for the board, I think that those two pieces need to find a way to coexist within that framework. Around the training and development piece, I think again, sort of building on the training we've already had, and then sort of continuing to weave that through. I think another piece that sticks out to me is the sort of 21st century challenges in local government. The rapidly growing costs are not always the issue as much as the symptom of a greater issue, and that is that increasing requirement in some cases for a greater level of responsibility to be borne by local government, and then the demands of our communities that are asking local government to step up and take a greater role. And the watershed and housing functions are two examples. Through the referendum, it was shown that there is an expectation on the part of the broader community to take a role in those responsibilities that haven't traditionally been local government. So around training and development, I'd also like to see on top of that good governance best practices and roles and responsibilities and leadership training, sort of some reflection if we can. And I know there are some good consultants out there that can give some perspective on the local government challenges we face today, and how those affect everything from the work that we do. So that feeds back into the compensation piece, if you will, but also into the respectful workplace and code of conduct. So there is some connections between these pieces. And I guess just finally, for a question for staff, as a human resources professional, you must sort of glean some symptoms, if you will, of some of the, and I'm not sure, and I'm sorry I don't know this, but how long you've been working in local government, but I don't know if in conjunction with some of the staff that have long-term experience in local government, have you seen that growth in responsibilities with local elected officials, or the workload increasing on people, or the stresses that come with the job increasing over the last several years, or is it something that you haven't really reflected on?
Mrs.
Through the
Bohan.
chair.
Through the chair, thanks. So I've been in local government for about 15 years, but the bulk of that was in a smaller community in Powell River. So I think that the main component of the service commitment that elected officials make that distinguishes one from the other is discretionary. And from a human resources perspective, that is part of the problem when looking at compensation as a whole, is that, you know, for people who are committed to the role, they can choose to spend a lot of time in the role. There are people who are committed to the role, and depending on the demands of their own electorate or the size of their area, may not need or choose to put in as much time. So it's highly variable. I won't deny that expectations from the public are probably going up over time, but how that actually plays out in terms of how elected officials choose to serve their electorate is highly variable. And so that makes it difficult from an HR perspective to measure and quantify because it's discretionary. So yeah, it's a bit of a challenge. I do recognize that from my perspective, the way elected office has happened in the past has not always encouraged people from the broad spectrum of society to consider themselves a candidate for elected office because of the perception of the commitment versus the compensation. So I do understand that that can be a barrier to a layperson or a citizen who wants to serve. And I don't think when those barriers are there, that in a democracy you get good representation. So I think that there's definitely work to be done, but it's challenging because there's no prescriptive format for how much time you put in, what kind of background or experience you need, what kind of education you need. And to even put some of those things in place sometimes flies in the face of democratic principles. So it is a challenge. Yeah, so that's what I have to say about it for now. So.
Thank you. Follow up? Director
And I guess
Stone.
the other part that I think about is reflecting on that is the healthy work-life balance. You can see elected officials that seem to be able to breeze through the workload and the stresses that come with the job, and you can see that others are detrimentally impacted by it, that it can be such a level of stress that it causes hardship in their lives and, you know, mental health challenges and physical health challenges. I put on 30 pounds in the last 4 years. And those are not always a choice that people feel free to make. They feel an obligation, and they should, when they run for elected office, to serve their communities the best they can. But I think maybe that comes in under the training and development pieces, is having people that are professionals in those areas, helping elected officials deal with the stresses that come with the job and develop an appropriate work-life balance for their own health, because the more mentally and physically healthy you are, the better we can all serve our communities. So not, coming up with any solutions here, but I think that's another thing we need to consider.
Thank you. Any other comments from committee? I would just add for myself, if we could have the conversation of benefits on a later date, that might also include some incentive as to, like what Ms. Mohan talked about, attracting the whole spectrum of community to want to enter office. Perhaps we look at things like being able to extend your education or childcare, or I'm not sure exactly how that would look, but just some added benefits that would add to the scope of our compensation. And I look to Mrs. Mohan. Do we need any other direction on these pieces? Can we bring what wasn't discussed back again, or? Thank you.
Through the chair, I think that it's clear to me that code of conduct is the first priority, and I'll bring some examples forward. And secondly, to deal with the sort of more timely issue of the benefits plan, the formal benefits plan. And then beyond that, I would recommend that the committee subsequently identify its priorities, again, because it will have participated in some training by that time. And then you can see how much time you have left and, the scope of the work. So I think we're good to go for the first couple of meetings, and then maybe check in at that point about what else you want to accomplish.
Okay. Thank you, Mrs. Mohan. Oh, we have a comment from Mr. Kieber.
Thank you, Madam Chair. So I just wanted to, at this point, bring up the point that at this point, there are no additional funds in the budget for 2019 for any increases in wages or benefits. We're still in the budget process, so that's possible to change, but at this point, that's the case.
Thank you. Does anybody want to discuss that at the moment? Who was first? Director Marsh.
Not that directly, but the budget. So are there funds through you, Madam Chair, through to Mr. Kieber or the manager of finance, who I forget her last name? Ms. Weiner, thank you. Are there funds for training or in development for the board, or would that have to be added to the budget?
Mrs. Warner.
Waiter.
Waiter, sorry.
No worries. There are funds in the budget, but that's only based on last year's training funds and budgets. If there's extra training or anything like that, it would have to be added before the budget process is completed.
So perhaps, Madam Chair, would it be appropriate for us to have a report on how much is available now before because if we want to come up with a elaborate plan if we can't fund it.
Just looking into it right now.
Okay, thank you.
Mrs. Mohan.
And just to make the board aware, those funds are identifiable in your budget documents for this year. So you should be able to find that information yourself if you want to go looking for it after the meeting. So.
except it might be something we want to discuss right now. Director Stone, you still have a comment?
Yeah, around the compensation piece, recognizing that there's no money in the budget and this is a difficult budget year, my contention would be that this would be providing work to the board that would be considered for next year's budget. There was an increase to compensate for the change in the tax regime from the federal government that took place starting in 2019. So that piece was done at that time. I think the board decided that that was what was tenable from the board perspective, and I think that, you know, we could honor that, and when we bring these recommendations back to the board, they would be for consideration of the 2020 forward budget process.
Director Morrison?
And this question might be perhaps through to Mr. Kieber, through you to Mr. Kieber. I'm anticipating the board will look to returning to the December 31 approval of the 2020 budget, going back to the normal budgeting process. And given we're looking at a June wrap-up date for this committee, possibly through you to Mr. Kieber, when would the direction around changes to compensation be required for the next budget cycle?
Mr. Kieber?
Thank you, Madam Chair. So the wind-up of this committee for the end of June, any direction at that point in time is more than enough time for us to include into the 2020 budget.
Thank you. So is the committee okay with having this discussion later, and we will look to 2020 financing any benefits or extra compensation? Okay. Any more discussion on R1? Mrs. Mohan?
Just to advise that the information that we're going to discuss in the next report about an option for increasing the benefit plan for elected officials actually needs to be committed to, if the board chooses to go in that direction, by the end of February, which means that, and it's the plan that's on offer is a comprehensive 4-year plan, and so it would actually require, if the board chose to go that direction, it would require an adjustment to the 2019 budget. So, which is part of why it's important to discuss today, because of the timeliness of that. Additionally, if a different decision were made and the board were to purchase benefits through our regular insurance carrier, our renewal is generally March 1st, and so that commitment would also have to be made in advance and committed to for the 2019 budget. So there's not an opportunity next year to join the UBCM elected officials benefit plan. It's a one-shot deal for 4 years. So there may need to be a budget adjustment fairly quickly here if the board chooses to go that direction. And I can go into more detail with the report, but I
R2.
just wanted to qualify what was just said about making plans to change budgets in future years, when in fact there's something that's kind of urgent that might need to be decided today
Thank you.
or soon.
Director Morrison, do you still have a comment? No, I'm just ready for R2. Okay. We're good to move on to R2 then. Yes? Oh, Mr. Barron.
And Madam Chair, for anybody watching on the streaming, R2 is a report from the Manager of Human Resources regarding elected officials' benefit plan comparison.
Thank you. Mrs. Mohan.
Thank you. And through the chair, there was some information, not quite a report, but some information in your package about one of the options available to elected officials for benefits. So currently, and since I think approximately 2013, the elected officials, a number of elected officials have participated in a benefits insurance plan through UBCM that's designed specifically for elected officials. So currently there are 5 people participating on the plan, and there are 2 who have expressed interest in registering for this plan. And so that plan is outlined in the table in the first column, the current plan. It's a very bare bones plan, and coincident with the election cycle, the UBCM asks for input on the plan for changes. And so based on input from the last term, they've offered some extras in the plan. So they now have a standard plan and an enhanced plan. And so that is an option for this group or any part of this group, as long as there's 3 that want to enroll in the plan. So the plan is offered through UBCM, but the underwriter is Pacific Blue Cross. And so one of the things that UBCM offers is actually group benefits for local government employees through a Pacific Blue Cross plan. And we don't have our benefits through Pacific Blue Cross. Our current carrier is Manulife. So when employee groups are part of the UBCM benefits plan with Pacific Blue Cross, there's a third or another option, which is that elected officials can piggyback somewhat on the employee requirements. One is that at least 3 elected officials be in the group in order to qualify for the group plan. As you can see, it does not provide long-term disability or short-term disability or critical illness insurance. The enrollment deadline is February 28th of 2019. And when you enroll in this plan, you are making a commitment for 4 years. You can't opt out after 1 year, for instance, or after 2 years. So you're making a 4-year commitment. And so I did some quick math, but I'm going to say at the outset that if this is something the board wants to pursue, I'm going to be submitting the financials to finance just for confirmation. But essentially, the difference is about $500 for a single person in the plan and about $1,000 for a family participant in the plan to go from what is currently offered to the enhanced plan. And you can see the differences in the table. The dental plan does not, there's no additional offering on the dental plan, it's identical. So I wanted to make a comment about the Employee Family Assistance Program. Currently elected officials are covered through Vancouver Island Counseling, the EFAP program that we subscribe to. It's unlimited in terms of the number of counseling visits that you can have for yourself or your direct dependents. If there are complicated issues, there's a referral made to a provider, which would then fall under the paramedical practitioners in the covered benefits plan. The EFAP program that is offered through the UBCM plan is a little bit different. So it is based on a telephone support system, so it's like a hotline support, and then there's referrals made from your phone support conversation. So some people, there are pros and cons to those 2 systems, and we can talk about those if you desire, but in my opinion, we get a very high level of service through our local counseling provider, and I would suggest that the telephone support may be a lower level of service, especially if you don't have good coverage on psychologists and psychiatrists and other kinds of counselors. So, so that's something to note in the difference between these plans.
Director Nicholson.
So is, it looks like in 2019 through UBCM plan, you don't have an option of the local.
So what I would say to you is that you're paying for it, but we also have coverage.
You
through
also
the-
have coverage through-
Yes,
okay.
but you're paying for this support as well. It's in the premium, I believe.
But your other coverage can extend to directors.
It does, yes.
Director Marsh?
So to clarify, if this committee decided to recommend to the board the enhanced Blue Cross UBCM, board directors would still be able to access unlimited counseling through Vancouver Island Counseling?
That's correct, yeah.
Okay, and that's because through Manulife or?
No, the contract is with Vancouver Island Counseling, which
Oh,
has a
great.
local office, and so, yeah, we pay a premium for everybody there, and you can see it's a slightly higher one. But we pay an annual contract with them based on the number of people covered in our organization. So that's there anyways. I mean, the board could decide if they went with the enhanced plan not to pay for coverage through EFAP, but I would suggest that the service you're getting for the price there is excellent value, so.
Yeah, I've actually used that service, and I'm very, very, very impressed with the level of professionalism there, and, yeah. So I would recommend that if that's, yeah.
Director Stone?
So just a couple of questions through to staff. Is the current plan paid by the directors or by the regional district?
It's covered by the regional district.
Okay, and that's only electoral area directors then? So this is not available to municipal directors?
Well, No, it's available to municipal directors, but in terms of participation, municipal directors are often able to choose and piggyback on a plan that is offered to their employees, so they don't always participate because they have better coverage elsewhere. Additionally, it's not, there have been historically a lot of elected officials who are currently working full-time in the workforce and have coverage through their employers or through their spouse. So there hasn't always been huge uptake on the plan, and that's partly why they insist on at least 3 elected officials, because,
Well, and that's why I was asking about the participation, because in municipals, you got 7 people, it's often hard to get the 3 people, because they still require 3 from a smaller city council, and if you don't have the 3 participants, I guess if we step back and look at it, it makes me wonder if there was some collaboration that could happen between all the local governments around this, rather than everybody trying to do it piecemeal and having different packages available. Now, of course, I only sit here and represent my community, but if there was agreements that could be made amongst all the local governments, you would think there would be some order of magnitude that could make it more attainable. I'm just not sure how the regulation would work around that.
Mrs. Mohan?
So I think that the level of cooperation you're looking for is exactly what UBCM sets out to do, but it's difficult, and there are challenges to providing benefits to elected officials, especially because of what I said before around what is considered actively at work, and is it a salary or is it a stipend or is it it becomes very challenging for a plan to offer something and underwrite something. So I think that the idea behind the UBCM plan is to offer exactly what, like a pooling kind of effect. So one of my suggestions, and it was one that I made last spring when we reviewed this, was to give your input to UBCM. If you are part of this plan, make sure you're frequently giving input to UBCM about what the needs are, because they do look at it on a every 4-year basis, and they try to negotiate a better plan. So, but before we go too much further on what UBCM offers, there is another option that is currently in play that I think I've mentioned in the notes in your package, which is that it's standard practice for an organization to shop their benefits plan on a regular basis, and we are shopping our plan right now. So our benefits agent is taking our employee data and our history to the market to get quotes on benefit plans for our employees. And based on the interest shown during the last term, I've included in that request for quote, what, would it be available and what would be the cost of having elected officials piggyback on or have a plan through whatever carrier is landed, making a quote for that business. So right now we're with Manulife, and Manulife will submit a quote, most likely. But we will get quotes from other carriers. So that provides some opportunities. One, we might find that there is a plan for elected officials that is providing more at a similar cost or an affordable cost. We may find that we get a plan design where it says the elected officials can piggyback on the employee's plan. We may find that Pacific Blue Cross puts in the best bid and we change to Pacific Blue Cross, and then subsequently through UBCM, the elected officials can have access to a better plan. So there's a lot of what ifs out there right now. From a timing perspective, our renewal on our employee plan is March 1st. So it's coincident, and that's pretty typical because they want a year's of data to look at, the last year's data to look at. So we expect quotes back from our insurer starting early or mid-February, and we'll be making a decision on whether or not to change benefits carrier for our employee plans. So one of the options available to the board is to have a meeting very close to the time that we receive that information before making a decision here, and then quickly make a decision about which route you'd like to go with the plans, and then very quickly bring it to the board should it, for a budget amendment, should it require additional spending beyond what's currently being spent on benefits.
I had Director Morrison, Marshstone back on the list.
Oh,
follow-up?
sorry. Yeah, just a follow-up. Just the last question I had was just whether they could stack benefits. So if they had a private plan, a lot of times if your spouses both have plans, you can submit to both streams, so you actually get 100% coverage.
Mrs.
Yes,
Mohan?
Through the chair, yes, that's generally accepted practice in the insurance industry. Usually there's a preferred payer, and then if you're the second payer, you'll make up the difference, basically,
Okay.
so.
Makes me wonder why anybody would not opt in if the CVRD was paying the premiums.
Thank you. We had Director Morrison, then Director Marsh.
So I'll try and be brief. And I had background in this in my previous working life, and so I spent a lot of time at UBCM last year chasing the UBCM staff around and the Pacific Blue Cross, who happened to have a booth at UBCM. What was very interesting is when I made my initial calls after Ms. Mohan and I had spoken after a meeting that was held last year, the UBCM folks had about this much response from elected officials as to their program. I don't know why, but I learned a whole bunch about it, and when I maybe used some unflattering words to describe what their plan was, when they took a look at it, they realized, yep, this is about as bare bones as you can get for a program. And that's when I learned too that you could also, if your local government was through the UPCM program, that you just almost automatically got the ability to tap into the full package. I aggressively pursued improvements to the program. So the basic program, I think, looks a little better but the enhanced one with the eyeglasses and the likes and the increase and seems to be a little better than the worst of the bare bones. And I would, personally be interested in looking at something like that. However, I think we've got some homework to do, because regardless of whether we look at one of these options or go to the market, the response that we get, we should know the numbers of the directors that are interested in the benefits package, and we should probably be prepared to make a decision either way as to whether or not we go with the UBCM plan, and that's a full-on commitment. I'm really bothered by at February 28th at 11:59, we either have to be in that program, and is it going to be we would have to say no to the UBCM plan and trust that we're able to enroll in the new package. Is that not the case?
Mrs. Mohan?
Through the chair, yes, technically, but we also have to decide our employee benefits plan by that date too. It's because our renewal is March 1st. So we have to decide whether or not we're switching the employee benefits plan, I would think, at least a week or two before March 1st.
Okay.
So
So I guess as a follow-up, then we should poll the board as soon as possible and look at what the level of interest might be as far as the package and go from there.
Thank you.
Would that
Director
be
Marsh, I
a
have
next step through you to staff?
Mrs. Mohan?
in order to keep the UBCM plan option on the table, I need to know that at least 3 people would be interested in going forward. But beyond that, it remains to be seen what the different carriers will require in terms of a participation rate. So sometimes they'll come back and they'll say, we can only provide you a group plan if everybody enrolls. And that's typically what employee plans dictate. There's no opting out of an employee plan. It's everybody or no one. And so I expect there may be something like that coming from industry who are bidding on our benefits plan if they want to cover elected officials. So
I have Director Marsh, Yanni DiNardo, and then Director Wilson.
It looks like I had my microphone on already.
Yeah,
Sorry about
you're
that.
heavy breathing the whole time.
Yeah, sorry about that. So I was just looking at a former pay stub of North Cowichan, and I wanted to let you know that I believe the plan that we get at North Cowichan, or the benefits we get at North Cowichan, are very close to the enhanced plan, although routine dental is 100% covered at North Cowichan. And I think that our restorative might be 80%, but we pay $212, or the district does on our behalf, $212.80 a month for a family. I don't know what it would be for a single, but I still have 2 children on that plan, so it's a family plan. And I'm trying to remember if we're Equitable Life or Blue Cross, because we keep switching, and I can't remember which one we've switched to now, but. So the other coverage looks pretty much the same, except for the counseling is through Vancouver Island Counseling. But the eye coverage and all the other things are pretty much the same. It's just the dental is
But
higher.
you're saying we would have that anyway. Next, we have Director Yanni DiNardo.
Thank you, Madam Chair. We already have 5 board members on this one, so I'm assuming they'd still be on, so we do have our 3. And I would say that the enhanced plan is that one thing that we can vote on here while in process with staff looking at the other one. Like, we could give direction to approving the enhanced plan now and waiting to see what the carriers are coming back with. So I'd like to
So,
make that motion.
A motion to approve
Accept the
the
enhanced
enhanced
plan.
as our number 1 choice at the moment without knowing what's coming. Something, that sounds pretty official. Do we need a motion to that effect, Mr. Barry, or?
You should have a motion and it should be written. Thank you. You should have a motion and it should be written down because we're gonna have to get this in the minutes and obviously there may be ultimately something that goes to the board as well. So we need to get the wording the way it should be.
Could you have the wording for us? I still had Director Wilson on the list here. Could you write it up while we have comments from Director Wilson?
Thank you, Madam Chair. I'm purely here as an observer, but just following on from what Chairman Morrison said, I don't have a medical plan. I've always been self-employed for the last 20 years, and it's very difficult to get this kind of coverage. So I obviously have been corresponding with Mrs. Mohan and following along. I'd go in 100% on even if the basic was available to us, because it's far better than I have at the moment, which is not very much. However, the enhanced plan, from what I've seen, is more expensive, but not to the extent that it's hugely more expensive. And at the moment, from what I can see, there are 4 board members here, at least 3 of which would be joining that plan anyway. Is that correct, Laurie? Correct. Yeah. So really, right here, we have the 3 that we need. So I would agree if I won't vote on it, but the motion before the floor at the moment, it's fine by me.
Okay, so Mr. Barry, do you have a suggestion for us?
No,
okay.
at this moment, I don't, Madam Chair. The person who moved it, if they could repeat what they said?
I have some wording if you,
Oh.
unless you've got it.
Or microphone, please. Director Yanni DiNardo.
I was just going to recommend to the board that we accept the enhanced plan currently that's been given to us while staff is researching another carrier. So I don't know how we.
So perhaps at the moment, could we vote on a motion on?
Accepting this.
Accept the enhanced plan as our number 1 choice until we have further
Confirmation from the carriers, CVRD's carrier.
choices? It's our number 1 choice at the moment because we don't have any other before us. Director Morrison.
I think I'm hearing rumblings in the back that maybe we should ensure that there's appropriate resources made available in the budget as well. I don't know if that's a 2 to this resolution or not, or do we already have appropriate resources in there?
Mr. Kieber?
Madam Chair, no, there aren't at this point, but if the board, this committee recommends to the board an increase to the enhanced plan, staff will then do the calculations with HR's help, determine what the impact would be, and that would then be going forward to the board at the next meeting, which is January 31st.
Thank you. Should we call the question?
Madam Chair, the reason why I'm being,
Yes,
say,
please.
persnickety about the
Yes.
wording, we're talking about health benefits, and I've heard words like accept. I don't believe that's the word we need to use. And I'm looking at the HR, And the finance areas, what wording do you need, would UBCM require? Because it wouldn't be accept.
Mrs. Mohan?
So I actually don't believe that UBCM requires a resolution of any sort. They just need the registration form. So we don't need to satisfy any requirement by them. Usually the wording is enroll, so motion to enroll in the enhanced plan from UBCM as a first choice while staff researches other carrier options.
So moved.
Moved. Is there a seconder to that effect?
I do.
Call the question.
Do we need to add
Oh,
and have it provide?
no, we don't. Okay, so we're going with the motion that Mrs. Mohan stated. All in favor? Opposed? Motion's carried. And Director Stone?
So I didn't really get an answer to this, if anybody has any insight. If the CVRD pays for this benefits and they are indeed stackable, unless you have a crazy deluxe work healthcare plan, why would anybody not opt in for this? I'm just trying to understand from an HR perspective or finance, does anybody understand why they wouldn't opt in? Because if you get, there's very few plans that give you 100% on everything. If you've got a plan that gives you 50% on dental, restorative, and you've got another plan that gives you 50% restorative dental, that means if you stack the plans, you'd get 100% coverage, right? So if the CVRD is paying for it, I'm just not sure why anybody would not opt in. So I don't know if anybody has any
My
insight to
understanding is
that.
there's premiums, but I'll let Mrs.
But the
Mohan.
CVRD pays the premiums.
100%. We'll let Mrs. Mohan.
So through the chair, yes, the CVRD pays the premiums, and yes, I believe there's no really logical reason other than additional cost when you don't need
Tax.
additional coverage, yeah.
Or taxable benefit, right? Is it?
Yeah, taxable benefits.
Okay.
Um,
Go ahead.
I just have
Mrs.
one
Mohan?
clarifying
Yep.
question, but only if Director Stone's finished.
Director Stone, are you finished with your questions?
Nope. So where do the benefits come from in the budget? What department? So assuming that, you have a smattering of electoral area directors that participate, does each area pay for their own director's benefits in terms of or if it comes out of general government, are the municipalities paying for a function they don't participate in?
Mr. Kieber?
So at this point in time, the only participants are electoral area directors. So at this point in time, it comes out of budget 250. However, in my discussion with the manager of finances, we are going to be doing the calculations with the enhanced plan for the cost for the entire board, which will be going up in general government.
Okay. All right.
you.
And then my last question
Director
was-
Stone?
Final question, on a follow-up was, and this goes back to an earlier question, is there any way for us to collaborate as all the 5 local governments? Well, but not really, because I've got 6 counselors back at Ladysmith that are still trying to struggle to find 3 members of our council to participate because the municipality does not pay for benefits for local elected officials. So I'm just trying to find a way that we can get maybe some cohesiveness in the region and make it better value for all. And then if it's in general government and every elected official is covered through general government of the CVRD, I'm not sure how that would work. I was just trying to think of, if we're going to have a committee that's supposed to come up with some creative ideas, maybe that was one that we could think of.
Mrs. Mohan?
Through the chair, it's probably possible. You would need to find a carrier interested in providing that product and setting some criteria around it, and I'm not sure, I'm not experienced with how to go about that, but I'd certainly be willing to try if it were something that this committee was interested in pursuing. So, I mean, from what I understand of the insurance business, it's based on pooling groups. And so if you had a pooled group, you should be able to find a product, but it also depends a little bit on market and whether or not there's appetite to go into that market. So I think it would be somewhat experimental from us, but it's certainly something you could ask about, yeah.
Mrs. Weiner wanted to make a comment.
Through the chair, yeah, in my past experience, we've tried doing this with smaller municipalities because it was a struggle, but it went by location definitely for the UBCM benefits, and so that's why we were not able to pool it together. However, independent carrier might be able to do something, but once again, I think they tend to go just by locations.
But is it the will of the committee to ask staff to verify that or to research that a little bit? Mrs. Mohan?
Through the chair, certainly if the this committee was interested, now would be the time, because I have made the request of our agent to get quotes on coverages, so I could also make the request of our agent to ask the question of the different groups that quote on whether or not a pooled plan like that was a possibility.
Director Marsh had a comment.
So, I'm just trying to think this out, because certainly I know that the North Cowichan councillors do have coverage. And I certainly wouldn't refuse being able to get 100% certain kind of coverage, but I would have trouble paying 100% into two plans. Do you know what I mean? So I'm not sure that we can, you could check with our HR, that we could or even would want to, depending on what you come with, give up what we presently have. Do you see what I'm saying? It might be complicated for North Cowichan, because I don't want to say, I don't want to get, do you know what I'm saying? I have a plan
Mrs.
through North
Mohan.
Cowichan.
I think I understand, but I think that Director Stone's point is that whereas in North Cowichan, you're paying part of the premium, and you wouldn't necessarily volunteer to pay two premiums for
Okay.
double coverage, here at the CVRD pays for the coverage, so you're not out of pocket, and yet you get more coverage. So I don't think it would be, you wouldn't be double paying for coverage if that's
Okay.
a concern. In a sense, the taxpayer would be paying a little bit for double coverage, but not you as an individual.
Well, that's what I meant, though.
Thank you.
So then, yes, I do understand.
Director Stone.
So my thought was that we stop doing it municipally, and we all collaborate together on doing it regionally, so that all of the local governments say, hey, listen, elected official benefits are a challenging issue for all local governments. If we pool our resources and our elected officials and use the regional district, which has the broadest reach, as the vehicle to get coverage for all elected officials in the region, that was my idea. I know if it unnecessarily complicates it, maybe we set this aside for the future, but that was my idea. That we collaborate with the municipalities and say, okay, it's hard to get three people at, say, maybe Lake Cowichan and Ladysmith and so on. Maybe, well, and if it was paid for, I don't think it would be hard to. But could we collaborate and have all elected officials within the region get a benefits program through CVRD and then through general government, so all of our community members are paying based on assessment equally throughout the region?
Director Stone, Morrison.
So, exactly what he said, but direct staff to explore CVRD-wide pooled benefits for elected officials. And that way, it's looser and gives more flexibility for them to explore and cost and all that stuff. So I would move that.
Is there a seconder? Is that motion okay, Mr. Barry?
If it's presented in writing or somebody has it.
I am almost finished. I can't spell right.
Mr. Kieber has a comment before we,
I see problems with this, and the problem I see that is, now we're gonna ask electoral area E, for example, to pay for their share of all of Ladysmith's director's expenses, or all of North Cowichan's expenses. So we're increasing the electoral area directors, where there's not a whole committee behind area E or F or whoever. So if I heard, the assumption I was making is, or I think I got, was that the CVRD would be paying it. And I see that as a problem.
Director Stone?
Conversely, there's one director at the table here from the third largest, tied for second assessment area within the region that's paying for, if we're going through general government, would be paying for 14 other directors' share of benefits. So the inverse is also true, that if we go through general government for benefits, and you take an assessment area like Ladysmith or Shawnigan Lake, for example, the residents of that electoral area in our municipality will be paying a disproportionate share of the smaller area directors' benefit costs. So I think there's some calculations we'd have to do there, but if you have an assessment area, and just, you mentioned, I think, Area E, that has this much input into general government, and then you have an assessment area like Shawnigan Lake or Ladysmith that puts in disproportionately higher based on assessment into general government, the inverse is true. So if you only cover the one assigned director that comes to the board from the municipalities, North Cowichan would be a much more glaring example.
have no idea why that's happening.
Mute your phone.
I did.
So I would argue that the inverse would also be true, that if we're going to fund the benefits through general government, that the municipalities, especially North Cowichan, would be paying a disproportionate percentage of benefits for all the electoral area directors that have much smaller assessment bases.
Director Morrison?
And
Oh,
I'm just.
sorry, did Mr. Keeber? Can I, okay, go ahead, Director
Well-
Morrison,
well,
sorry,
I-
and then Mr. Keeber.
This is way down the path here. Let's explore, and these are questions and debates and stuff that we can have after we've got
Afterwards.
information before us.
Mr. Keeber?
Actually, it's not. This has to be decided within a month. So there has to be decided within a month and agreed to in a month, because it has to be done by the end of February.
Right.
But we can't decide now.
I feel like we're complicating things, but we can we can vote on it. Director Marsh?
Yeah, if I'm understanding that it's possible that the taxpayers in North Cowichan, if we pass this, would not only be paying for our 7 members' present benefits, but would then also be paying for our 7 members to have additional benefits and a portion of everybody else around this table. Is that right?
Yes.
If it comes out of general government, then, well, that's how general government works. We pay a percentage of the whole, and North Cowichan pays the largest percentage. So I need to clarify. I'm already uncomfortable having them pay my little $200 a month. I surely wouldn't be comfortable having them pay that double and then everyone else. Is that what I'm hearing could happen?
Director, oh, sorry, Mrs. Weiner.
Through the chair to Director Marsh, I think the plan is that they would not be paying for those other, like North Cowichan would not be paying the benefits over there. It would be paid through this pooled plan. However, that being said, there's already agreements in place for these benefits in every other place. So you'd have to do the timing to go into effect when those benefit plans expire as well.
Mrs. Mohan?
I think in terms of timeliness, the first decision that has to be put to rest is whether to join the UBCM enhanced plan, because that will commit you to 4 years and it will preclude any other considerations. However, if we come to the table and there's a good offer on an elected officials plan through our benefits carrier, whatever benefits one we choose, then we're really only committed to that for 1 year. And then that would give the board more time to consider the creation or explore an enhanced plan, but you would have to forego, in order to do that, you'd have to forego commitment to that UBCM plan, because once you do that, you're in for 4 years. So there is a degree of flexibility about considering this issue, but only at the expense of enrolling in the UBCM plan.
Director Morrison? Oh, sorry, I had Director Nicholson next.
Yes.
And then Director Morrison. Forgive me.
Just to speak to the issue of Ladysmith councillors having trouble finding 3 people, is it not possible if we do the UBCM plan, end up doing the UBCM plan, for us to run them through our thing and then just charge back to Ladysmith? Why is that not possible?
Mrs. Mohan?
I believe it goes back to what Ms. Weiner was saying about location and organization. So the way the policy is structured, it's by local government. So we would be asking UBCM to change the conditions of their plan, which they only do by, suggestion every 4 years. So right now, I don't think that's a possibility because of the way they structure their offering. So.
It just strikes me that they're part of the regional district, so it's kind of like.
Mrs. Weiner?
Through the chair, the problem is they're not actually directors of this board. So because they're not active directors of this board, they cannot be funded through the UBCM Pacific Blue Cross plan. So as much as the regional district and that municipality is a part of the regional district, they're not directors at the table.
Director Morrison?
Really trying to simplify things here, because we're talking about creating a new animal, and it all depends on whether or not the service providers will even consider creating a pooled group of elected officials from the regional district, from municipalities and electoral areas. That's the intent of this question. Ms. Mohan could make inquiries and get 5 no's. Issue's done. So that's the intent of the motion. Investigate the possibility of pooled for elected officials, full stop. Then if the answer is yes or maybe, then we can get into the peculiarities of how it might be set up, how it might be funded, that sort of thing. So that's the full intent of the motion. Go explore.
My question is this actually urgent though? Because we are really busy right now. No, but this pooling it, because what I'm hearing is we can only do that if we don't go with the UBCM. So can we not just wait and let Mrs.
Well, no,
Mohan do?
we're in
check-
then. We're in. We gotta go to UBCM or nothing.
Yeah, at the moment, but that might change if there's a better plan presented before March 1st.
Right.
Right? So then if that happens, I'm saying that's when we could ask Mrs. Mohan to further investigate the possibility of exploring pooling with other municipalities, and we could have that conversation again. Because, is that what you
confused.
just said? Okay.
Yeah,
Yes,
please.
Director Stone.
So what he was saying is Ms. Mohan will come back to us and say, yeah, it's a non-starter, end of discussion. These are the 2 options that you have, or the one option is UBCM benefits plan, which we've already passed a resolution that says we recommend to the board that if there isn't a better option, that we go with the enhanced plan for the directors. And if there is an option, then we can have the subsequent discussion about all the other stuff.
Right.
We just had so
Thank
much
you.
time and nothing else to talk about,
Right.
so I was digging into it.
Do you need any more direction around R2, Mrs. Mohan?
Madam
No, I
Chair?
think I understand. Yeah.
Motion on the floor.
We still have a motion on the floor.
We have a
for
motion on the floor
second.
that a report be prepared exploring CVRD-wide pooled benefits for elected officials.
Did we have a seconder for that?
Yep.
Okay, call the question. All in favor? You guys- No. Okay, motion passes.
It's carried.
Thank you. Oh, sorry, no one's opposed.
So
And
Madam-
we should discuss our next meeting.
Yes, Madam Chair, just wrapping up R2, you really should decide here while you're all available when your next meeting will be. You can either leave it at the call of the chair, and that can get a little difficult sometimes, but if you have your calendars here, set your next date now.
I would ask the committee, does Thursdays at this time work? Do we want to keep it at this time, or do we want to explore other options? Any suggestions, comments? Okay, Director, so we'll stick with Thursdays at 1:30. Today was not every Thursday. This was the 3rd Thursday of the month. Do we,
Madam Chair, I was going to suggest
wish-
that, put that forward. If you wish, you could meet on the 3rd Thursday of each month, because the the agenda review is on the 4th, or the meeting's on the 4th, so you're reviewing on the 3rd week.
okay, so keep it as is, the 3rd
3rd
Thursday of the month at 1:30. Is that going to be okay for Mrs. Mohan? Mrs. Mohan?
Through the chair, yes, that date will work for me. And I'm hoping that by that time we'll have some responses from our market survey. The 28th, yeah.
Is there any other order of business from anyone? Any more comments? We're good. And Mr. Barry?
There's nobody here for question period, so a motion to adjourn.
Motion to adjourn, anyone opposed? No, motion carries. Thank you.